health in children. Mackenzie just started our recording so that we'll be able to share this with participants who weren't able to be with us. I'm very excited to share that we have some new staff joining our Children's Mental Health Matters campaign. So I want to let each of our new staff members take a moment to introduce themselves. We are working through some technical challenges. With our presenter, Barry Klein. So that'll give me a minute to finish getting the email with the information that she's going to share with us, and then I'll do an introduction and we'll get started. So Mackenzie, if you want to say hello and introduce yourself.
Hi everyone, my name is Mackenzie Goldsmith. I am the new Community Education Program Coordinator here with the Mental Health Association of Maryland. It's so nice to meet you all.
Hi there, I'm Angie McRae. I'm the Child and Family Engagement Manager here. And likewise, love to see all of you here this morning rather.
And I am Jess Port. I am the Child and Family Program Manager here at the Mental Health Association of Maryland. Great to see everyone.
I am Heidi Rochon. I'm the Chief Program Officer here at the Mental Health Association, and I'm really excited to have a very full team today, starting to pull this programming together for you. And I thank all of you guys for being here and welcome your feedback as we continue to expand this program. So thank you, everyone. Thank you, Amanda, and you can continue.
Great. So we are very, very excited in our Mental Health Association of Maryland world to be expanding our team for the Children's Mental Health Matters campaign, and excited to be able to bring this information to you. So Barry, our presenter this morning, is having a little bit of technical challenges. So we're going to kind of do some different kind of presenting, but she is able to join us here by phone, and I'll be sharing her slides once we get started. So I just wanted to take just a quick moment to introduce Barry and tell you a little bit about her. So Barry Klein is the Executive Director of Healthy Harford, the Healthy Communities Initiative of Harford County, a nonprofit 501c3 coalition of local government agencies, businesses, nonprofits, and citizens dedicated to improving the health of Harford County residents through education, policy changes, access to care, with a focus on social determinants of health. She has over 25-year history of work in public health, including environmental and reproductive health, as well as early childhood development. She is an active member of the Harford County Local Health Improvement Coalition, or LHIC, and currently serves as the chair of the LHIC Behavioral Health Work Group and the Harford County Mental Health and Addiction Advisory Council, in addition to several other boards. She keeps herself very busy. In her spare time, Ms. Klein is dedicated to exploring the gut and brain connection and how good nutrition can support mental well-being. So we are very excited to have her join us to share information about how our lifestyles and choices can impact our mental health and mental wellness. So Barry, I will go ahead and turn it over to you. My email has not come in yet with the slides, but I will be ready as soon as it does. And Barry, your phone is on mute, just so you're aware.
Okay. All right, there we go. So obviously not very technical.
Okay. Yeah. So Barry, if you're on the Zoom call, I think you can probably close out your phone line, and I just got the slides. So I will get those ready to share right now.
Okay. I apologize for all the technical difficulties. This best laid plans. Okay. I think I might be able to pull them up, Amanda. Let me give it a go.
Okay,
Can
perfect.
you-
I've got them. Yep. Let me make sure that you have screen sharing abilities, and I've got them available if for some reason you cannot. You should be able to share now. Excellent. See, we just had to give everything just a little reboot. So I'm going to go ahead and turn it over to Barry, who will give our presentation. If at any point you have questions during the presentation, feel free to type those into the chat. We'll be monitoring those, and we should have some time for questions and answers at the end of the session. And then we'll also have a really brief evaluation for you to complete at the end as well. So with that being said, I will stop talking and turn it over to you, Barry.
Okay, great. Thank you very much for inviting me. So what we're going to talk about is pretty macro. So it's going to be a very general overview of health and wellness, and then we're going to get a little bit more granular towards the end about how the health and wellness will affect people's mental health. At any time, please just either raise your hand or just interrupt me, and we can address your questions as they come. So the first thing I wanted to point out is this is a photo of what people eat around the world. So as you'll see, the diets in a modern world are very, very different depending on which country you come from. The one thing I'd like to point out when you look at the American family, how incredibly different that looks from everybody else. So if you look at most other countries, their diet is not too dissimilar, but ours is very much different from all of the rest of them. Any particular thing that people notice about how the American diet differs?
I don't really see a lot of fruits and vegetables on there compared to some of the other, there's a lot, like lots of fruits and vegetables across many of the other ones. And I see maybe some grapes on our American one. I'm getting a lot of
Yes,
responses,
definitely.
people talking about very highly processed foods.
Exactly, and that's kind of where we're going to focus. So as a general rule, when we talk about nutrition, nutrition is an evolving science, and you'll hear a lot about macronutrients and which is better and what kind of diet is the talk of the town. But at the end of the day, the science is in agreement across the board on a couple of very salient things. So one of them is, as a rule, we should focus on eating real foods, foods that you can identify just by looking at them. You don't have to read the label, so to speak. So there's a famous saying by Michael Pollan that you all probably have heard, and it's called "Eat food, mostly plants, and not too much." And eat plants, not food made in plants. And honestly, if you're looking at any general nutrition information, if you just follow those two pieces of information, you're probably going to be just fine. So a lot of times people just talk about why is good nutrition so important to begin with. And although we might not think about it, everything we put in our mouth, every cell in our body is built upon that. We are not plants. We don't necessarily, except for the idea of taking in vitamin D from the sun, where we build our body from is what we consume, the food we eat, the liquids we drink, the air we breathe. And so there's no way that our diet does not in fact affect both our physical and our mental well-being. So I want to just be clear that during this entire presentation, I'm not going to talk about good food versus bad food. I don't think there's such a thing as bad food, so to speak, but that food is on a continuum. There are certain foods we should be eating more of, and there's certain foods we should be eating less of. But I think a lot of food disordered eating comes from the fact that we start to vilify certain foods, and that's not the intent here. So just to give a brief overview of what macronutrients are, but just so that we're all starting on the same page. So we're talking about proteins, carbs, and fats, and each of them have a distinct purpose. So protein is mostly for building muscles, which is why you see a lot of exercise people or people who are concerned with building muscle focusing on their protein. This is also an issue for seniors as well, because seniors tend to lose muscle. Carbohydrates are quick energy. They also provide fiber. So when people talk about removing carbs from their diet, you have to understand that they're also removing an excellent source of fiber from their diet, assuming that it's a whole grain. And then fats are really just stored energy, and they burn very slowly. So if you're talking about keeping hunger at bay for a long period of time, fats are where you're going. Any questions about that? Okay, I'm just gonna Okay. Amanda, I'm not going to be able to monitor the chat. So if there's something in there that you think I need to stop and address, please just let me know.
Will do. I'm keeping an eye.
Okay. So this is something I really want you to take note of. So it might look familiar to many of you as the My Plate, but the reality is this is sort of the genesis of the My Plate. We all, or many of us, grew up with the food pyramid, and it just came about that the food pyramid really just wasn't very effective at communicating nutrition. So the Harvard Chan School of Public Health came up with this, what's called the healthy eating plate. And then this piece was then handed over to government entities and changed to become the government's My Plate. But this is the original, and the things that you might notice that are different from this versus the government version is that there's no dairy on here. And in fact, Canada doesn't include dairy on theirs as well. So sometimes when we come across things that are issued by the government, there are some lobbyists that are involved. So I'd like to show where the scientists came out on this versus where perhaps there might have been some influence. So the other thing is they talk a lot about healthy proteins and not so much meats, because again, the phraseology matters. So the one thing I really want you to notice when we're looking at this plate, the big thing that is the big communication piece when we're talking about health literacy is that 50% of this plate are fruit and vegetables, with the vegetables being more heavily emphasized. There's a reason for that. And that there also is a reason for them pointing out very succinctly that potatoes and French fries do not count as a vegetable. Because understanding that the majority of the vegetable consumption in the United States are potatoes and French fries. So really just, if there's any takeaway from this, if you're looking at creating a healthy plate, if half of that plate is vegetables and then some fruit, you're probably doing okay. Okay, so when people say, well, I need numbers, I need some daily guidance. So if you're looking at some of the prevailing guidance that's out there from the American Heart Association, from the Diabetes Association, these are the numbers that you're going to be looking at. So these are for healthy adults. So obviously the numbers will be slightly different for children. And I know we're talking about children, but for healthy adults, this is what we're looking at. Now, knowing that if we're talking about diabetics, that carb number is going to be very much towards the lower end, and that for people with high blood pressure, that sodium level will be much lower. For children, what people just don't tend to notice a lot of, because the first protein, carbs, fats, sodium, not as interesting for children, but that sugar number. So 24 grams of sugar for children or women and children equate to only 6 teaspoons of sugar a day. So your average, just to give you an idea, your average peanut butter and jelly sandwich probably meets that requirement. So that's from everything that you eat or drink for an entire day. So you can see why something as simple as a peanut butter and jelly sandwich with maybe some chocolate milk already puts our average child well over the recommended amount of sugar for the daily for their daily day. And the other number I would say to notice is fiber, because as a culture, historically, with our processed foods, we are all very, very low on that fiber number as well. So this is just a simple food label. And I'm showing this because I'm always amazed that when I go out into the public, how few people honestly know how to read the food label. So when you're looking at this, not only are you looking at the total sugars, or if we're really being accurate, we look at the added sugars, but also looking at the total carb number. But the most important piece I would want to point out is this servings per container number. So the numbers that are on this food label are really focused on per serving. So you can see it in very tiny letters above calories, amount per serving. And then they're also saying that there are 4 servings in this container. I can tell you, just as a real world example, when you're looking at a box of mac and cheese, they're saying that that box of mac and cheese is 1/3 of that box is a serving. I don't know of anybody who eats 1/3 of a box of mac and cheese. So these numbers on this nutrition fact label can be incredibly deceiving if we don't understand how to read them, because all of these numbers that are listed here, including the calories, would be ×4 if you eat the entire package. So this is just a general like a infographic general piece. And really what we're focusing is getting more of the things on the left and less of the things on the right. And again, if you just eat those things listed on the bottom, the fruits and vegetables, the whole grain, you'll probably be just fine. So what I wanted to focus on, now that we've kind of just done the basics, are these ultra processed foods. So if you look at this picture, it pretty much is a standard cupboard if you were to open up an average cupboard in the US. But what this shows is that, you know, going back to that first picture, a lot of the food, in fact, most of the food I would challenge in our grocery stores really fall under this ultra processed food moniker. So the idea behind ultra processed foods is, from a manufacturing perspective, is to design these highly profitable foods that are made with low quality ingredients, that are convenient and ready to eat, but that they are made with these additives and preservatives that normally you would not find in food, in order to make them more shelf stable, in order to make them more palatable, and in order to make them more visibly attractive. So when someone said to me, well, how can you tell if something's ultra processed? Well, usually if it comes in a package and it has 1 or 2 ingredients that you would never ever find in your own kitchen, it's probably an ultra processed food. And that's not hard and fast, but as a rule, that's generally the case. So why is this even an issue? So the issue behind this is, back in the later part of the 19th and early part of the 20th century, when people were concerned about food shortages and how they were going to solve them. World War II was ramping up. They were looking at ways to feed large mobile populations, and how to make the food last longer, and how to make the food consistent. And that's really the genesis of where all these alternative food-like products came about, and when they started being added into our food supply. So for example, butter's been around for millennia, but butter does have a finite shelf life. So one of the first artificially constructed food, which means a food that was never found in nature, was Crisco. It was this idea of taking cottonseed oil, which is a surplus from the cotton industry, and bleaching it and heating it and reprocessing it and creating a shelf-stable, flavorless added fat, which would supply energy and yet would not have that same short shelf life as something made with a more natural product. And that's kind of where a lot of these products come in, where you've got artificial fats in there, artificial sugars in there, not necessarily sugar that's found in nature, and a lot of preservatives and colorings and all of these other modifiable pieces that our body may not necessarily be able to process. So the reason why this is an issue is because 60% of the American diet is made up of these ultra processed foods. So honestly, if you're going back, you know, a generation or so, there would be some of this, and that's not going to be the turning point. The turning point, when it's above 50% and everybody's consuming this, that's when you start to see some public health switches in health issues. One of the reasons that it also is a problem is that our bodies not only don't know how to process these fats and these sugars, but they also bypass the natural ability for our bodies to shut off. So just to give you an example, I don't know if many of you remember, but back in the day, Jay Leno was making a commercial for Doritos, and he's saying, can't eat just one. Well, that was a very, very true statement. A lot of these foods have an addictive property to them because there are chemists that have actually created something called the bliss point, which is that perfect blend of the trifecta of fat, sugar, and salt that hits all of those positive dopamine receptors in your brain and says, this is amazing, and I don't want to stop eating this. So it almost hijacks your brain to make you want to eat more of it. And sugar and, it says here sugar and food, that's a typo. It should be sugar and salt are the two greatest food additives in terms of driving appetite. So you'll hear a lot of people, I'm a savory person or I'm a sugar person. And those are the things that really get them excited about eating that food to excess. Chips being one of them, ice cream being another example. So the reason why this is an issue is because most of these foods add a tremendous number of extra calories to our diet, in addition to some of these inflammatory properties, but they don't add any nutritional value. So we actually have people that are morbidly obese and yet are malnourished because they have a lot of excess calories in their diet, but they don't necessarily have all of their nutritional needs met. So ironically, there's a story that people tell that if you go into somebody's house and you see a sugar bowl, not necessarily one that you use for coffee, but like an actual one that you would use, for cooking in the kitchen, is that a sign of a healthy diet or an unhealthy diet? And one of the researchers in this actually said, when we see a sugar bowl like that in somebody's kitchen, it's usually a sign of a healthy diet because it means that that family is actually cooking. So I thought that was interesting. It's not so much that the sugar is the thing to worry about. It's the idea of, are these people eating an ultra processed diet or a more natural diet? So it's listed here, food additives, sometimes that are substituted for actual food, modified food starches, gums. You've heard of guar gum or carotene or xanthan gum, which is in absolutely everything. These are all things that are there to mimic the food that has been taken out. So usually it's the fat or something that would give body to the product, or maybe an egg that acts as something that would bind the product. But these are low quality substitutions that sort of give you that mouthfeel, but absolutely do not supply you with any nutritional value. So when we look at things that are low fat or low sugar, unless you have a medical reason for those things, usually they are not a healthy substitution. And then the final piece I want to mention is that, we do have this low fat craze, but the brain actually needs fat. The myosin sheaths that protect our neurons are all fat. Fat is has a lot of calories that help endure with the energy, and fat is just a necessary piece.
Barry, before you keep going, we've got a little bit of discussion kind of happening in the chat. People talking about, the challenge with healthier options costing more at the grocery store, and how it can be really difficult to keep especially teenagers full and satisfied, especially related to healthy foods. And just any suggestions or thoughts you might have on how do you bring in healthier foods into the diet when you're on a limited budget or fixed income, or just maybe don't even have access to those resources?
Absolutely. Those are excellent points. So here's the thing, diets of what we call diets of poverty. So traditional diets of people throughout the world tend to be low cost diets. And yet what they do involve, which we might be a whole different discussion, is time to cook. So for example, traditional Asian diets tend to rely heavily on rice. African diets tend to rely heavily on sweet potatoes and yams. Obviously Latin American diets, corn. So those are excellent bases. They're whole food products. Obviously I'm going to talk about rice and talking about brown rice, but those are excellent, very inexpensive products that really help fill people, and yet are whole food products with a lot of nutritional value that really can elevate a dish. So something super simple, when people talk about making something quick for their kids that most teenagers will like. I've never met a teenager that didn't like Chipotle. And yet something like that is such an inexpensive, very quick, very teen-friendly thing to produce. So you just make some rice, which honestly you could do in advance and just keep it in the fridge. and then marry that with a can of rinsed black beans and a jar of decent salsa, you're talking about, you know, maybe 20 minutes worth of labor and something that they'll usually dive into. Now, if you want to add, you know, additional protein to that beyond the beans, which in itself is a great source of protein, you can add some chopped chicken, but you don't have to, because that whole rice bean combination is an excellent source of protein. So you can add any vegetable to that, whatever you happen to have in the house, or even canned. So, you know, it really is what you're going to add to that is personal preference. I wouldn't say that you'd even need the cheese, because that's pretty optional, but if you have it, you can definitely add it. But I would look towards some of those excellent sources of carbs as a base. A lot of kids also like loaded potatoes. So you can basically take a potato and nuke it for 5 to 8 minutes, depending on the size of the potato, and add whatever you have in the house. It doesn't have to be a set dinner. And that could be an excellent dinner. You could even just fry an egg and put that over the top. A lot of people don't think of eggs as being a food past breakfast, but in many cultures, it certainly is. Especially Asian cultures, you'll usually see an egg just thrown on top of soup or on top of rice bowls just to add extra protein. I think when people really delve into eating whole foods versus processed foods, the cost is pretty comparable. I think where the fall down is for a lot of people is that learning curve of learning how to cook if they don't know how to cook. And a lot of people just have lost that skill. And I think a lot of it is being able to get into a groove where you're planning in advance. So we do try, in fact, we have a whole series of videos on middle schoolers, how to cook for themselves. And it's something as simple as, you know, for breakfast, just nuking a sweet potato, which they could actually carry in their pocket as a hand warmer. And then when they want to, where they want to be, they can just twist it in half and use it as a push pop. And that is an excellent breakfast. But people just need to think outside the box of cereal conundrum that we all face, thinking that's all we need. That's all we can eat for breakfast. Does that address any of those issues at all?
Yeah, I think we've got a lot of other people mentioning some kind of additional thoughts as well. And interestingly enough, I actually just read an article this week about when you let starchy foods like pasta or rice cool and then eat them later, you actually are building a more resistant starch, which is healthier for you compared to the starch that's there. I guess the cooling process kind of binds those starch molecules together and they become more resistant, and that's a healthier starch for people. And I thought that was really interesting and made me think, okay, well, maybe in the weekends I can make a bunch of rice and then have that ready to make burrito bowls or something throughout the week, and then it's
Right.
actually a healthier choice. That was fascinating to me.
And, you know, there is something to be said for making like a whole grain. I'm not going to lie. It takes a long time to cook whole grains. It could take 45 minutes. So, you know, if I would suggest one thing is, you know, just make one for the week and make enough for it to be portioned out for the whole rest of the week. People are amazed that when they start switching to whole grains, how few they could eat. Like when you can eat an amazing amount of, say, pizza because it's refined white flour, or an amazing amount of white rice because it's a refined product. But when you start using those full grain wheat berries or brown rice, the quantity in which you could consume, especially if you're drinking along with that, is drastically reduced. And I would suggest to anyone who's interested in making that switch that they really should do it slowly, because there can definitely be some gastro repercussions if you switch to a very high diet very quickly. So just putting that out there. It can be a persona non grata at a lot of gatherings if you make that switch too fast. So I see some great questions in the chat, but I'm going to move on because I think I might address some of them. Yeah, so I like that someone wrote focusing on fats and higher protein helps with being satiated. So a lot of times someone will say, I'm not going to eat a salad
Barry, I think we lost your audio, or at least I did.
I did too.
Okay. Hold, please. I am afraid she may have gotten kicked out, so hopefully she'll be back here in just a moment. Great discussion, though, and really excellent questions and thoughts on kind of how to adjust diets. And Heidi, thank you for sharing the information from the Rural Health Conference. I know that that's always been a challenge. And
Did I lose all of you? I have no idea where I was.
okay, you were about to tell us, we were talking about diet and lifestyle changes, and don't go too fast when you switch over to whole grains.
Am I connected still, Amanda? I can't tell.
You are. Yep, we hear you.
Okay. I'm sorry. I really, I'm so sorry about all of this,
No worries.
this issue. Okay,
Do you
so
want me to share the slides, maybe to lighten the load on your system?
if you think that would help, I'm definitely open to that because I don't want to keep on messing up your meeting.
No, you're good. You're good. We definitely, I mean, we only lost you for a second. So I am happy to share the slides. I think we were about to head into inflammation. Let me go ahead and share my screen. And all right, can everyone still see the slides okay?
It's not showing up for us well, Amanda.
My computer does weird things when I try to like put it into full screen mode. So let me take it off of that really quick. And did we lose Barry's audio again? I think we might have. Okay, here she is. She's back. All
Amanda,
right.
are you bring up the screen?
Yep, I am just going to do that right now. My computer was doing weird things, so now I'm going to get it to not do weird things. Okay, how's that? Does that work for everyone?
Yep, it works. Thank you,
Okay.
Amanda.
Perfect. All right. Go ahead, Barry.
Okay, so one of the other downsides of all of these ultra processed foods is how it is the inflammatory effect. So the problem with inflammation, it really is the root of a lot of chronic health conditions. And I'm not going to delve into this slide. Hopefully you can see it, but it really affects just about every body system we have. I know with most people talk about inflammation, a lot of people are concerned with the GI tract and the rise in issues like Crohn's disease and colitis and things such as that. And it is a very valid concern. And there are some people that do consider ultra processed foods as an implicator in some of these issues with some of the chronic inflammation in people's guts. For that, I mean, I am not a clinician, so I'm not going to say you should eat this or you should not eat that. But what I would say is that if you are finding that you're having problems with your gut, the recommendation is to keep a food diary for at least 3 weeks. and kind of track your symptoms to see whether or not you can find some patterns between what you're eating and the reaction that your belly is having, knowing that it takes a number of hours for something to travel through your intestinal tract. Next slide. Okay. Another issue too is that a lot of research is showing that food that is very high in fat and sugar, which ultra-processed foods are, can definitely produce a dopamine hit. And so what the concern is that going back to that example of the Doritos, is that it can get people caught in this dietary pleasure trap where they're really, really worried about people, again, overeating, a lot of extra calories with no nutritional value, because they just get these cravings for these ultra processed foods. And honestly, the advertising does not help this, because we all know that our appetite begins with just even a suggestion or a visualization of something, and being bombarded constantly with media and messaging and jingles and colorful packaging is a definite enticer for this. And then couple that with a hijacking of our brain, it does make it incredibly challenging to get away from it. But just to kind of give you an example of how do you know that you've been influenced by this. If you give a child something natural, we'll just pick on baked potatoes for a second. You know, you give them a baked potato and you put some healthy toppings on or whatever, they're only going to eat a finite amount of that. But you sit them in front of a bag of, you know, potato chips or Pringles. Pringles seem to be a perennial favorite. They can eat an entire sleeve of that with absolutely no sign of stopping. So you can just see how your brain processes those two very similar-ish foods very differently. Next slide. Okay, so I pulled this is a quote from a book, which I think is a fantastic read if you're into nonfiction. It's called Ultra Processed People. I think it probably could have been a lot shorter, but if you like to skim, it's great. But this basically says the reason why this is such a big issue is that so many kids are involved in this, and what happens is that because they are so receptive to this dopamine response, that they really, when they're building their bodies, when they're building their foundational wellness for the rest of their lives, they really can be sidelined into building their bodies in an unhealthy way. We see diabetes starting at a much younger age. We see a lot of other inflammatory diseases starting at a much younger age. We see all kinds of things that used to be considered old people's diseases showing up in a much younger, either adolescent or young adult population. And so what the concern is that the next generation is going to have a drastically worse health long-term because of this foundational poor diet that they've been raised on, that will carry over into adulthood. Next slide. The other thing, not to just focus solely on food, is that we should also notice that what we eat is affected by our lack of sleep. The fact that many of us are chronically dehydrated, and that also the food environment in which we eat is not always ideal. You know, American food culture, we tend to make fun of it, but it does involve very stressful timed eating. It involves eating while walking often. And even the environment in which our kids are raised within the school system, it's a very chaotic environment. You look at other cultures, eating is a time to reconnect and to relax, and we just do not have that. The hydration piece, I just want to point out that 50% of the added sugar in the American diet is what we drink. So our drinks are larger, they're much sweeter, and they have very little nutritional value. So again, you know, instead of the whole Capri Sun or, you know, any of the energy drinks or any of those other things that we tend to see a lot of our youth drinking, focusing on much better options such as water. Next slide. Okay, so this is more of a practical slide. When people ask me, how do I know what's wrong with my digestion, I just pull out this very simple chart. And the reason why we like this chart is that, I'm sorry, something just popped up, is that it really works well for kids that aren't good communicators, or kids who are even prelingual, so the little bitties. You know, any of us who are parents know that so many of the questions that we receive from our caregivers are, well, what does their diaper look like? And yet we sort of lose that as we go on. But kids can self-diagnose themselves. Like if they have a headache, drink more water. If they're having issues with diarrhea, well, what does your diet look like? You know, how were you eating? Were you running while you were eating? Did you have anything healthy? And this is a very private way for a lot of teens to kind of self-evaluate where their diet is as well. Next slide. Okay, so these are just the simple takeaways. When we're talking about nutrition, I just like to use the term nourishing people, not just feeding them. So being mindful of that, what you are placing in front of somebody is not just there to satiate them, to take away their hunger, but really is there to build a well body. And that calories are units of energy, but, you know, everyone says a calorie is a calorie is a calorie. Well, that's great, except it doesn't really speak to what other nutritional supports that food is providing. So 100 calories of Oreos is not the same as 100 calories of apple. And the other thing is your body can often tell you what it needs. So if you have a headache, check out that you're thirsty first before taking a pill. If your stool does not look appropriate, kind of use that as some sort of diagnostic. If you're craving something, all I want is sweets, do kind of a mental wellness check. Am I just feeling unhappy? Do I need that dopamine hit? Did I get enough sleep? Those kind of things. Don't always think that hunger is straight away hunger. Hunger could also be an indicator of something a little bit more. Sleep, hydration, and the environment are a big part of nutrition. It's not only just what we eat, but how we eat. You know, so many of us are sitting in front of a computer when we eat, or walking, or, you know, in the car. And how does that affect nutrition? How does that affect wellness? I mean, I myself am guilty. I'll eat a bag of something and don't even realize it and wonder who took it because it's all gone, but yet it was just me. Because we're not mindful when we're consuming. And remembering that ultra-processed foods were not designed to keep us well. They were designed solely for profitability, you know? And so our wellness was not top of consideration when these things were put together. They are highly profitable, shelf-stable, not very nutritious foods. And if our own personal priority, I always tell the kids, don't let the marketers tell you what you should eat, let your body tell you. If we're really mindful of what is best for us, we really need to focus on a very different priority than the marketers. And for the takeaways, people always say, well, it's not convenient. Well, unfortunately, we're made to think that it's not convenient, but fruit is ready packaged. A lot of vegetables are ready packaged. Sometimes you can eat grains raw, like a rolled oat. You don't have to necessarily cook that. Nuts are always ready to eat. These are very high quality grab and go foods that we just don't think about when we're thinking about something to just throw in our bag. But a handful of nuts is a much better choice than a granola bar. So just kind of getting out of that mindset, keeping food bowls and having people grab it. And I do know that cost is definitely consideration with people, but again, I would stress those foundational meals based on good quality carbs instead of high expensive meat, of which we do not need such large portions. And as far as the vegetables are concerned, frozen is just as great as fresh. In some instances, depending on the season, you know, we're headed into winter, frozen could be even more nutritional than fresh. And then with the canned, I would just suggest rinsing them to bring down that sodium content. Next slide. I believe that's it, actually. Yep. Okay, so I'm just looking really quickly at some of these chat pieces.
Well, thank you
Yeah.
so much, Barry, for sharing all that information. We do have a couple minutes. Does anyone have any other questions or comments about things that we have not had an opportunity to cover?
So I like this comment about Laura Herrera Scott, said she was quick to mention that her family of four made an attempt to live on SNAP benefit limit for a month eating healthy and ran out of money 1/3 of the way. True. I am not going to defend SNAP. The amount is ridiculous. However, I do think with some planful, you can do a little bit better than 1/3 of the way. And I'd be curious to see what her menu was, but I am not here to defend the SNAP amounts because we definitely need more
I
support for
totally
our
understand. I think that for me, the point was the congressman was really, really quick to blame families for making those choices of how dare they be so careless to buy these processed foods. And I think it's a matter of education, it's a matter of understanding, and all of that is combined. So absolutely. I see somebody wrote, what are the resources to help families? That isn't really important as a part of that. It was interesting. Before the congressman said that, I had spoke with a family member that said, I can't wait to be rich enough that I can buy healthy foods for my family. And that like hurt my heart to think that she thought that way. And this was really enlightening to help me. Actually, I just messaged her and said, I'm going to share a link with you to a training today. So thank you.
Honestly, I do think that we have lost the art of cooking. So what we have found just statistically is that people born outside of the US actually have, for the same amount of, for the same income level, have a much better level of nutrition and cook much healthier food. So I do think that there is a cultural issue in the US about defaulting to processed foods. I think our kids are inundated from a young age, and we just sort of fall into it because it's easy. You know, we don't have communal dinners. We don't live in extended families. There's just not that same level of support for eating well that maybe exists in other countries. And honestly, like if you even just go out and grab something quick, what are our options here? They're all fast food, but not necessarily something that's decent. Where, you know, if anybody ever wants to Google, look at a lunch from Italy or China or Africa versus what's served to our students, it's just so completely different. And the difference being processed food versus unprocessed food. I don't think the cost is the consideration.
Barry, do you have any suggestions on how to help educate families to plan for healthy food habits? Any um, good sort of tips on recipes to share or um, meal planning or kind of just any good resources that might help families plan for more healthy food habits?
Sure. So so we have a number of websites listed on the Healthy Hartford webpage. So I would definitely suggest that people go and follow that. There is one woman, there's a couple of blogs that we have listed there. Some of them are a little bit fancier for those that are kind of further along in their journey, but one of them is like a busy family of 6. And it's just these parents posting what they cook every week, so you don't have to figure it out, quite honestly. But I would say a big piece too is have the kids be part of this process. Statistically, people will eat things that they've had a hand in creating. They don't necessarily want something new thrown in front of them and someone says, taste this. So if the kids are part of the process, then I would say that would be a big first step. So we have something upcoming with the Village of Lakeview. It's going to start, I believe it's December 5th. Dr. Marie Kanegi McAleese, who is she's a pediatrician by training, but she's also a certified lifestyle medicine doc, and she's going to be teaching a cooking class at Village of Lakeview. And I can send along that flyer for anybody who would like to participate. And she's an excellent source of nutrition and lifestyle and all of those things that you really need to help make that transition into just a better quality of food for your family.
Great. I put the Healthy Hartford website and Barry, is there a particular page that would also be helpful? A specific page that I should include as well?
Yeah, I'll send that to you. It's basically food
Okay, great.
resources. So just to kind of just take a bit of a segue, we also have on our webpage a list of all of the food pantries in Hartford County. So if someone is needing to supplement their SNAP benefits, we do have that as well.
Do you know, Barry, we have participants kind of from all over the state. Do you know if there's similar resources in other counties, and what would be the best way for people to find that information?
So I can speak to other counties. I think it's highly variable from one county to the next. But there are some national websites. I will send you a list because off the top of my head, I don't think that just listing them out is going to be very effective, but I could definitely send those to you
Great.
and you can distribute those.
Excellent.
But canned beans are 99 cents. Even organic ones on sale are only 99 cents. So if you build your meals around a quality carb and beans, of which there are a bazillion different kinds, think of Indian dal to Cuban black beans to Chinese mung beans. There really is tremendous diversity as well. So you don't have to get bored with that.
Great. Well, thank you. I know we're getting close to time. Mackenzie has put the link for our brief survey just to kind of let us know how this presentation was for you. And if you're interested in signing up for some of our other wellness webinars, we have that in there also. Barry, thank you so very much for sharing your time and knowledge with us, and we'll look forward to being able to send out some of those additional resources. So we thank you all for being here. If we have no other questions, we'll go ahead and give you a couple minutes back in your afternoon to hopefully go have some time to have a lunch that's not in front of your desk. So I hope everyone has a great rest of their day. Thank you for completing the survey. And Barry, again, thank you so much for sharing your knowledge with us. And we'll look forward to seeing you all at our next session. Will be scheduled for January. We're skipping December for the holiday season, but we will be back in January with humor and family fun. So it should be a great topic of conversation. So thank you, everyone. Have a wonderful Thanksgiving holiday, and we'll see you soon.